Hi, everybody. My name is Cary Ganz. I'm a dentist here in Garden City, New York, right across from Roosevelt Field Mall from the new Neiman Marcus. What I want to talk to you about today, something my wife suggested last night. We were watching a commercial on TV for Biotine, which is a saliva substitute. She said, "Well, why don't you do a little Facebook Live and mention, what xerostomia is all about and how to treat it and why it's important and why it happens." So I thought I would do that. This won't be very long, but I thought it was appropriate for a wide group of people. Xerostomia, which is basically another name for a dry mouth. It's a lack of saliva, and it can be caused by a number of different things. A dry mouth can be caused by medications that shut down the saliva production. It can be caused by radiation treatment if people are having radiation to the face. It can be caused just by getting older. When one gets older, the amount of saliva produced is reduced, etc. And there are conditions such as Sjogren's syndrome, which cause a reduction in saliva production. So there are numerous reasons why you may be experiencing what we call a dry mouth. Now, the first thing to do, obviously, is to find out why it's happening. It could also be a blocked salivary duct. There are times that the little ducts that allow saliva to flow into your mouth, those ducts can get blocked by calculus, by little stones, and sometimes that could just be the cause. Now, if that's the cause, typically what you'll find is, right before a meal or during a meal, your glands will get very swollen because the saliva has no place to go because the duct is blocked. Especially if it's totally blocked. So that's usually a sign and symptom that there's a blockage. But once again, there are numerous reasons why one would experience reduced salivary flow in a dry mouth. So, why is this important? Well, saliva bathes the mouth, and it removes bacteria from the teeth and from the gums, etc. So you need an adequate flow of saliva. You also need saliva for digestion. So it's important that you have adequate saliva flow. If you don't, you can experience a great deal of discomfort during eating. And equally as important, or maybe more important from a dental standpoint, is that you will experience increased potential for decay, for caries, for tooth decay. When the teeth are dry, the plaque sticks to the teeth, and you will experience a greater incidence of decay. That's important. So what do you do about it? Well, you can't just you can keep a bottle of water handy all the time, or you can use one of the saliva substitutes. Biotine happens to be one of them. There are several on the market. Just be careful if you have a low sodium diet restriction, because some of these do contain a relatively high amount of sodium. Now, what's really important is that you find out why this is happening. If it's just natural process of aging, then there's not much you can do about it. But if there are other reasons why this is happening, whether it's medication, radiation, whether it's a stone in the duct or whatever, there are tumors or other things that can cause it. You need to find out why you have that dry mouth. And then, if indeed that is something that cannot be controlled other than through using some of the substitutes, what's really important is you see your dentist more often, because you will experience a potential for greater decay, and that can be problematic from a number of standpoints. So what we suggest is that if our patients are experiencing that, we try to see them sometimes every other month, just to make sure we keep their mouths clean and make sure we don't allow the process to continue. We don't want them to experience decay, which becomes not only painful but costly, etc. So it's prevention here is a real important tool in the treatment of xerostomia. So anyway, that's really what it's all about. If anybody has a question about it, I'll stay on for a minute or two to see if there's any questions. Once again, I'll just review it for those that came on a little bit later, that xerostomia, or a dry mouth, can be caused by a number of different things. Medications, tumors, blockage of the salivary gland ducts with little stones. There are conditions such as Sjogren's syndrome, which cause a decrease in salivary production. There are many reasons. Just the aging process, as I mentioned, will very often cause a reduction in saliva. So, and the treatment for it is, if it's a stone in the duct, you remove the stone. If it's a medication, well, maybe there are other medications you can take that aren't as causal to salivary production. And if it's just a process of aging, then it's real important that you see a dentist more often to make sure that you don't experience excessive decay and other dental problems. As well as digestion. And you can use, once again, salivary substitutes. Just speak to your dentist and find out what he or she suggests. I hope this helps somebody. I'm not getting any comments, so either I've been very clear or it's really early in the morning and nobody has a comment to make. So I'm going to sign off. Once again, my name is Dr. Cary Ganz. We're here in Garden City, New York. I'll give you the phone number just in case anybody has any questions. I'll be happy to answer them for you. It's 516-741-1230. Once again, my phone number here is 516-741-1230. If you're here on Long Island, we'd love to see you. If you are anywhere else and have a question, please give us a call and make sure you see your dentist. Have a great and successful day.